Hello everyone, my name is Eileen Castellon. I am a student physical therapy assistant at CPT College and welcome to our week 7 video response. Today we will be focusing on proper skin care for a patient with burn injuries that they could follow at home. And to get started, we're going to be talking about soap. Now soap is very important for bathing and it is important to use a mild fragrance-free soap. The soap should be gentle on the skin and not cause any irritations. We should also avoid hot water because it can damage skin. The proper water would be lukewarm, and this could help reduce stress on the skin. Now we'll go ahead and talk about cream. The cream should be a hypoallergenic cream, fragrance-free, it should be moisturizing, and it could be an ointment if prescribed by your doctor. Now the doctor might also want to prescribe some creams with antibiotics, so if you do get those, go ahead and use those. You will want to apply this gently onto your skin and not do any rough rubbing. Now to apply your cream, you need to make sure that your skin is clean. And also apply the cream as needed during the day to make sure that you're maintaining that nice skin moisturize. Before you go outside, you want to make sure that you're using sunblock. And your sunblock should also be fragrance-free. And it should have at least 30 SPF before exposing your skin to the sun. And for additional protection, you could also go ahead and use some clothing to cover that damaged area that is healing. Now, to avoid some skin irritations, we can also accomplish this by using clothes that is a little bit more loose and fresh. Things like leather, polyester, nylon fabrics can cause some skin irritations because it can lock in the moisture and cause the skin to get itchy. So to avoid that, try to use clothing that's a little bit more loose. Also try to avoid using tape or bandages because it can also damage your skin by pulling. When you're pulling it off, you're going to get that skin stuck and it's going to damage that wound right there. If you do see any signs of redness around the area where your skin is healing, go ahead and consult with a doctor to make sure that everything's okay. To manage some itchiness, important that you always keep in mind, do not scratch. This can decrease the healing and increase your risk of getting infections. Instead, gently pat the skin around the area where you're feeling some itchiness. And if the itchiness is too much and it's starting to cause you pain, consult with your doctor and talk to them about a possible anti-itch cream that can help you reduce that itchiness and pain. Now, it's also important to make sure that you're keeping all your wounds nice and clean. And this is because we want to avoid any infections. When you're scratching or when you're not cleaning your wound, you're prone to get to more infections. So to allow this, we want to make sure that you are following either your doctor's orders or the nurse's orders and changing the dressing wraps, changing any bandages according to prevent any skin irritation or infection. Also important, you must observe your wounds and ensure that there's no swelling, no redness, or discharge. And if you do see any of these signs, make sure that you call your provider right away and let them know what's going on. I hope that this video was helpful for you all. Thank you for watching and see you next time.